Let's talk to Anne McElvoy now, Politico's co-host of politics at Sam and Anne's podcast. Anne, very good morning to you.
Morning.
Things not going great for old Keir Starmer. Wes Streeting's trying to find some hope in the NHS budget that might be able to give him something to cheer about. What's it all about, this moving of money from richer areas to poorer areas?
Well, I think this is really what we call pitch rolling towards this big NHS review, which is due very shortly in just over a week, with Wes Streeting very conscious of the fact that there are these huge health inequalities.
Yeah.
And it is true that if you live in a poorer part of the country, and especially if you're a longer way, like from a teaching hospital, like one of the big well-known teaching hospitals in your part of the country, often your care is worse, it's more delayed, you're delayed getting GP appointments. This is where things like cancer diagnosis really falls off a cliff for a lot of people, because they're too late in getting seen, they're too late in getting referred. You can imagine it all banks up, and then you've got outcomes which are far worse than for those living in better off areas. So Wes Streeting has put about 2.2 billion, he's saying, from the pot that he's got, into trying to do more on health inequalities. The big question will be then, what do you spend it on? If you just spend it at the front line, you pour more people into it, but they're not always there. They're always already trained up as doctors, nurses, clinicians. Or do you go down a route of more technology, but then you have to bring that in. There can be lots of mistakes with that, and also people need a while to get perhaps used to doing more telemedicine and more stuff that involves IT and even artificial intelligence.
Yeah, because we were hearing this morning that there's a plan to put, what they're calling ChatGPT into action. And a lot of people, funnily enough, this morning have been in touch with me saying, actually, where they are, it's already in place. That there are there's something called Dora, apparently, which is a female AI app which can talk to you about what you might have wrong. I'm still slightly unsure about AI, particularly if it comes to something as important as medicine, because I've found that whenever I've asked it a question, for example, and it may just be because I'm a bit old-fashioned, it gives a very generic sort of answer. It's not very specific. It's kind of, it sort of brings you all the bits of things that they've found on the internet, but it's not really necessarily going to diagnose you or tell you what you should do next.
Well, I'm going to challenge you a bit on that, Mike. I mean, if you want better healthcare, I study a lot of international healthcare systems, and the ones that are performing best are making the best use of big, what we call data sets. As much information as we can get about you or about the producer or about me, and therefore the medicine and the cures, the treatments are tailor-made to you. They're not just something that you talk about being, off the peg AI. Well, at the moment, your often diagnosis have been a bit sort of off the peg, and has got a lot better. But it is true that if you put bad AI, I mean, if you just to reassure people, doctors will not be using, or even, it doesn't even have to be doctors, but any health service, not just using something that you or I might type in and try to diagnose whether we've got a serious condition. That yes, there are with this sort of what we call word to text things, where you take this transcript of what we talked about, tidy it up, and then that would go to the next place. That is very sensible. You don't want to waste people's time typing things up. But yes, there are slips, there are misunderstandings. AI is learning as it goes. But there is no health system that I can foresee in the next years that does not productively make use of it. And I think it should speed up some of the awkward kind of interface that people have, where they're frustrated. How many times do you have to give your information if you go through a hospital process? Until the point of insanity,
Yeah, exactly. But this is the trouble, that they've taken, in previous incarnations, NHS sort of, modernisation apps have never really gone too well. They did that terrible idea back in the sort of early part of the century where I think they spent $4 billion on a new kind of IT system, which just didn't ever work. And you worry that the NHS, because it's so huge and cumbersome, just can't make anything work, really.
Yeah, but the app development now will be a lot better than it was then. And now you say that was an absolutely catastrophic misstep. And the NHS is a very big system, so when it missteps, it makes really big mistakes. But I do think AI health, or using, to be a bit less sort of pompous about it, just using more and more detailed information about the patient that can be handle. There's no way that amount of information can be done by people typing things in. I've got two parents who worked in the NHS, and my father was a senior administrator who sat there filling out large forms. If I did work experience with him, I basically totted up columns and passed them on paper to someone else. I mean, that's clearly not a way to run a health system. AI can be hugely helpful there, but we need much clearer information for patients about that their data is safe, it's secure, where it needs to be anonymous, that it's anonymized. On that, so I do have sympathy with your skepticism. I'm just saying, for the money that we have, the money we're ever likely to have, the aging population, that we all want better healthcare, there is no way around that. So I think that the Wes Streeting's focus, technology with a human face, if you like, is probably a good one.
Yeah. Well, we'll see. But good to talk to you, Anne. Thanks very much indeed. Anne McElvoy, the Politico's co-host of Politics at Sam and Anne's podcast, with much more faith in the NHS than I've got, I have to say. I'm not sure that anything that they now put money into will properly work unless they completely overhaul the way they do absolutely everything.